colleague and a friend. Dr. Maureen Lechfeld is originally from Suriname and is the Dean of the School of Public Health, the Jonas Salk Chair in Population Health, and Professor of Environmental and Occupational Health at the University of Pittsburgh. She's a member of the National Academy of Science and a member of the National Academy of Science Leadership Council with over 35 years of environmental and public health expertise. I've had the pleasure of working with her on the panel for climate change and health in the Caribbean. Her research focuses on environmentally induced disease, health disparities, climate and health, environmental health policy, disaster preparedness, public health systems, and community resilience. I have great pleasure in introducing Professor Maureen Lechfeld. Maureen, over to you. You're muted, you're muted.
So thank you, and I'm excited to be among so many friends, colleagues, and even more excited to begin this very important course for our region, for our nation, and for the world. So I will share my screen now. Do you see that? Okay, fantastic. And so mine was the special task to share with you and accomplish a number of learning objectives. As you can see, I not only have to tell you about the differences between natural climate variability and long-term climate change, but I need to talk to you about the differences, how to distinguish climate and weather, but particularly explain the main impacts of climate change and how the health sector itself needs to do something about it. So what's the difference between climate and weather? Climate is not the same as weather. Whether it's the minute by minute, that's what you see on the news, variation in conditions of the atmosphere on a local scale, whereas climate is really a description of an area's average weather condition and how those conditions change over time. So weather and climate in a popular way, weather is, we have to decide whether it's going to rain today, and therefore we need to get our gear together. But climate is really what you need permanently in your closet. So what is natural climate variability? Climate variability is how we, and the aspects of climate, how we experience the aspects of climate, such as temperature and precipitation, and how those differ from an average. So variability can be due to internal processes, and we'll talk a little bit about that, but also through anthropogenic external forces, and we'll talk about that. There's seasonal variation that happens on a multi-year cycle of warm and cool and wet and dry. We know that, we experience that in the Caribbean. Those do not represent climate change. So what then is climate change? It's a significant and persistent change in an area's average of conditions that are more extreme. As you can see, the temperature, for example, going up, the rise in temperature since 1980, you see that there's a significant increase in the temperature. So how do we know it's happening? And there's been a lot of talk, some not in the Caribbean, but in other areas, of, is this thing real? Is climate change real? And it is, because we see evidence in tree rings, in other national records, in scientific observations. And what we know is that the Earth's average temperature is now warmer than it has been in the past 1,300 years. We know that it has increased markedly over the past 50 years, and especially in the North Polar region. We also know that the long-term, the driving the Earth's long-term climate variability do not explain the rapid climate change that we're seeing in the recent decades. So climate change is happening. This is a more of a better depiction of how all the elements of climate change are impacting what we see and what we experience right now. So what are some impacts? We see these changes of particularly of the impact of warmer temperatures that are happening now, and many of these changes, and that's the sad part of it, many of these changes are irreversible and or are really at a tipping point and increasingly likely. So it's not something that will happen in the future, it's something that's happening right now. And as I lecture, I share often with students, even yesterday, that other than this temporary pandemic that we're dealing with, climate change is the singular largest public health threat that's facing us. And so we see the extreme heat threshold, and I'll come back to that. I come back particularly not only from a pure human health perspective, but also the impact on food systems and agriculture specifically. So in terms of oceans and health, we know that coastal erosion is real in the south of the US, but on many islands, coral bleaching directly impacts us in many, many ways. The increase in harmful algal blooms, disease outbreaks in marine species, but the acidification of oceans is what truly impacts the shellfish. Glaciers are less and less likely currently. And you see the impact here of between 2000 and 2019, 4 billion people were affected. 41% from flooding, 35% from drought. And so you see this almost paradoxical relationship between flooding and drought, and 18% of storms. We lost 1.2 million people from earthquakes, from storms, and from extreme temperatures. Particularly, our Caribbean countries have felt the brunt of the impact. Cuba and Dominica are on the top of that list of the top 10 countries that really have had their share. The earthquake in Haiti, and I'm so pleased to see so many Haitian colleagues joining us today. The impact is not only from an environmental perspective or a human health perspective, it's directly impacting both environment and human from an economic perspective. And here you see some of the data of the impact on countries with relatively small GDPs and the impact of storms from an economic perspective. So what do we see on small islands? Increase in temperature, more intense periods of tropical cyclones, storm surges, but also droughts, changing precipitation patterns, often heavier precipitation and more often and longer rainy periods. Sea level rise, I mentioned coral bleaching before, invasive species that we haven't seen on a daily basis. And so the notion of One Health becomes critically important in the context of climate and health. And all the things that we've already been experiencing, both in the natural and human systems. So do we agree on that climate change is happening? What's the consensus from a scientific perspective? Well, that consensus started since 2001, when the Intergovernmental Panel on Climate Change first stated that it existed. Now we're at 2022, and we now know that small islands are increasingly affected by increases in temperature. So we are very explicit about that now. We found that there's 99% consensus on human-caused climate change. And so we don't have to look any further than us for the majority of the impact of climate on health. So some physical climate drivers, there are natural drivers, soil irradiance, of course, there's volcanoes, we know about those. We know about anthropogenic drivers. We know about carbon dioxide, methane, and nitrous oxide. We know about short-lived climate forces. We also know about changes in land cover, particularly when we had deforestation. Now, here's the evidence. It doesn't matter, you don't, this is true in every language we speak, and I'm so pleased to see that we have so many of us with multiple languages appreciate. If you just look at the red line, you can see who causes predominantly climate change. It's not difficult to see. It is us. We know directly how this happens, and you have solar radiation creating that less heat is trapped in the atmosphere, and therefore more heat escapes, and the temperature gets warmer with all the impacts both on ecosystems and on human health. So let's look at greenhouse gas emissions by economic sector. We always think about transportation being big. Yes, transportation is big, but it's at 14%. Industry, it's at 21%. But look at electricity and heat production at 25%. And agriculture, almost matching that at 24%. And so the point here is that so much of this is preventable. So much of this we are in control of. So here's our first Zoom poll, and Haley will help us have you tell us what economic sector has the highest greenhouse gas emissions in your country. Choose one. We'll just take a minute or so for this poll. Good. I'm curious what the results are. Transportation and electricity and heat production. In fact, the answers match almost perfectly the poll, what we just saw before. Thank you. So we looked at natural drivers. What are some social drivers of greenhouse gas emissions? There is an association, as you know, between human activity and the changes in global greenhouse gas emissions. But those human activities are complex and they're interconnected. So identifying really cause and effect of greenhouse gas emissions are difficult. And so we use the term driver and not the term causes. So here are some social drivers. Economic growth, more economic development goes hand in hand with more use of energy, goes hand in hand with more use of greenhouse gas emissions. Population grows, more people need more electricity, need more transportation, eat more food. Inequality, and that definitely exists within our region and actually globally. And how we develop, and here is where we have a major opportunity to change how we develop our infrastructure, whether it's our transportation infrastructure or health system infrastructure, other infrastructures that we use, whether we create, how many trees we let go for building high rises. Those are all decisions that we make. We also make decisions about how we use the land and how much do we give up in terms of trees, as I mentioned before, and how we use technology to help us to solve some of these issues, to help us predict and be more integrated rather than taking a silo approach in addressing these social drivers. We talked about economic growth earlier, but economic growth and development, as I mentioned, are also major drivers of greenhouse gas emissions. Per capita, we grew 100% between 1970 and 2010, and that's only 40 years. And typically, countries with a higher income per capita tend to have higher energy use. That makes sense. But as those countries decarbonize, countries that can decouple will help have this decarbonizing even go faster. This gives you a sense, kind of hard to see, but this gives you a sense of the carbon footprint. And if you later enlarge the slide, you could see where your country is. Because, and I'm hoping that there are economists among the audience, and there are tourism experts in the audience, because economic growth is so also linked to consumption, we have an opportunity to make a change. Especially because production is tied to consumer behavior. What it is we buy really has direct impact in how much greenhouse gas emissions we create, what our footprint is. So buying local is one way to counter this. But as consumers, we can say we have little control, but there are ways that we can influence what's on the market, because there are ways we make decisions of what we buy. And so if we think about overconsumption, we also link that to what are some sustainable lifestyles, and overconsumption cannot be necessarily sustainable. The same way that we can't accept, we cannot tolerate to have more and more poverty happen, because that's socially unsustainable. So through which lens we look as we address economic growth and the tension between economic growth and consumption really relies on the decisions that we make as individuals and the decisions we make as governments. So we can take a bite out of climate change by eating more plant-based food, for example, and thinking clearly about what the health co-benefits are of what we do, what we buy, and what we eat. We talked briefly earlier about population growth, but between 1970 and 2010, the world population grew by 87%, a lot of people to feed. Most of the growth was in Asia, Latin America, and Africa. And so more people, more emissions, as we discussed, and working age populations having the most, of course, emissions. But a big but, the emissions increase per capita depends on where it is, the geographic location, depends heavily on income and which energy resources we use. There too, we have a chance to make a difference. Inequality is most pronounced often after a hurricane, a storm, an event, but inequality in climate change is almost a silent killer. It's very obvious, but it's difficult to contribute. As we mentioned before, it's drivers versus causes, but it definitely exists. And if you look at it globally, the richest 1% of the global population accounts for more than twice of the combined share of the poorest 50. And so as a region, the Caribbean and Latin America are disproportionately impacted by climate change, but do not produce the emissions that are associated with the richest countries. And so there lies the inequality. Now, I gave examples of infrastructure and transportation, roads and bridges, the way we build them, where we build them, how we build them, how we make physical infrastructure decisions. I lived and I still have a home in Atlanta where the 3 major highways come together right in the middle of the city. And so you can't go anywhere without being in the middle of the city. That is not productive. How we behave, as I talked about before, in terms of consumer behavior. If we have less of public transportation, it pushes us to have private vehicles, and private vehicles are contributing more and more to greenhouse gas emissions. So how do we get to a low carbon infrastructure? What's the will for us to invest in renewable energy? What's the will for us to do that? And how do we make our governments make those decisions? So here is our second poll, Haley, and I'd like to know what type of low carbon infrastructure is most needed in your country. Select one answer. A few more seconds. Okay, let's see the answers. By far and away, the renewable energy. Very interesting. Yeah, very interesting. And of course, the Caribbean is rich in the resources to create that. So many of you may have seen this slide from CDC, this depiction, actually excellent depiction of what the impact of climate change is on human health. I call it the wheel of death, particularly since the inner circle can actually rotate. The point is that whether we take rising temperatures or more extreme weather or rising sea levels or increasing CO2 levels, and we go out into the different slices of the pie, we find that environmental contamination, such as water quality or water and food impacts or extreme heat or changes in vector ecology, the changes in the environment directly impact a portfolio of diseases, from vector-borne diseases to cardiovascular disease to respiratory illnesses, but also, malnutrition, cholera, but also the two most important ones that people forget often, forced migration, the mental health impacts, and heat-related illnesses. And so I'm so pleased to have mental health professionals be part of our audience today. What makes us quantifying the impact of climate on health even more complex is the intersection with the social determinants of health, making a person, a population, a country more vulnerable. And so poverty, education level, where people live, the resources that they have, the access to care are all drivers that often are superimposed on what already is either an existing chronic condition or the impact on climate. From the Pan American Health Association, they did a country-wide survey. 18 countries participated, and you see the diseases of concern, and vector-borne, of course, is right up there. But I want you to pay attention to non-communicable diseases. They are on the rise, and the impact of climate change on those is often more pronounced and takes a longer time than often the impact on vector-borne diseases. It's also because we've seldom made the connection as prominently as we do with vector-borne diseases with non-communicable disease. So if you look at the Caribbean region per se, the small island development states, as I mentioned before, really contribute very little in terms of greenhouse gas emissions, but yet disproportionately are impacted. So our region is facing a triple threat. The disproportional high burden of non-communicable diseases, I mentioned that. If you look across many of our countries, it's cerebrovascular, cardiovascular, diabetes, and cancer. They go together. Epidemic and endemic infectious and zoonotic diseases, and a fragile health infrastructure, and I'll come back to that. And so this triple threat is also interconnected, and so one is related to the other. So there are vulnerable populations who are both hypertensive or diabetic and are at risk of dengue or other infectious disease and have limited access to healthcare. So if you take those three elements into account and overlay that, as you will see here, and overlay that with climate, you could see that it's not easy, and you cannot isolate one impact on the community. It is and disparities and disasters and environmental health threat and climate on top of that. Here is some other information about the disparate disease burden. This is 2019 information per 100,000 populations, and here you see clearly the prominence of non-communicable disease. So what are some pathways of climate and health? They are complex, as we mentioned before, but I'd like to look at three of those, and you'll have other colleagues talk specifically about these three in a lot more detail, but at least I'd like to show you those pathways: heat, drought, and Saharan dust. Let's look at heat first. They occur differently from island to island. Heat waves do. Hurricane Irma and Maria were excellent examples of those heat waves. And because there's really limited nighttime cooling, it compounds the impact often of hurricanes. We are particularly worried about heat stress in agricultural workers. While we know heat stress being connected to cardiovascular disease, we are increasingly seeing chronic kidney disease of unknown origin in otherwise very healthy agricultural workers, and there is some data out of Suriname that is confirming that. For example, there are many young people who are on dialysis in Suriname, agricultural workers, but who otherwise are not hypertensive or diabetic. And so we wonder whether this is a combined exposure of both pesticides as well as heat. And so this is, you see the difference between 2014 and 2019, a clear increase. So let's talk a little bit about drought. So we have drought and flooding happening often at the same time. There are a number of environmental surfaces that are impacted, from the availability of water to the quality of water, more dust, more wildfires, more disease factor populations, different behavior of some of those factors, definitely changes in socioeconomic pathways, from tourism is such an important source of income, clearly an impact on tourism, but also, and therefore also an impact on income levels. Specific to heat and specific to health-related adaptations, sorry, as I mentioned, agricultural workers already, we're particularly also worried about the rural populations. We talked about people with chronic conditions. We talked about older adults and with non-communicable diseases, but we should not forget pregnant women and very young children. And workers who are at risk because of drought. The human health impacts, as I mentioned before, yes, we know about respiratory, we talked about kidney disease. Do not forget stress, do not forget mental health. Those are real impacts of drought. You'll hear a lot more about this from Dr. Mendez, but this is a way to deal with Saharan dust that comes from, quote, the Sahara, indeed the Sahara in Africa, and is a constant culprit of respiratory diseases all the way in Puerto Rico. And so here you see with what happened when the early warning system really helped to deal with some of the Saharan dust, the impact of Saharan dust in Puerto Rico. I mentioned very briefly already the vulnerable populations, so older adults, and particularly heat is directly related to nursing home deaths after a disaster. When electricity is lost, many nursing homes are not equipped with the generator, and those are often the first people we lose. Low-income communities who may or may not always have electricity or ways to be able to ventilate their home. Communities of color, young children we mentioned already, and people who work outdoors. So how does the health sector impact climate change? Healthcare's climate footprint is not insignificant. It's 4.4%. So we can work on greening our healthcare facilities. We can use a number of areas, and you through the poll already said that solar panels, energy efficient equipment, waste management, that's where a big chunk of the greenhouse gas emissions come from. How do we operate? How do we create and develop our health facilities to operate in a safe way? And this is American data, but 67% or general in the Americas of health facilities are located in areas that are at risk of disasters. And I've lived 15 years in Louisiana, and that's absolutely correct. So how do we make decisions and think ahead of time in a predictive way where we place our healthcare facilities and how those healthcare facilities operate? The Pan American Health Organization has done a lot in creating smart hospitals, and there is a toolkit that is available from PAHO. This is our third poll. What are the top 3 adverse health effects of climate change in your country of work? So meaning where you work, sometimes you don't necessarily live where you work or where you're from. And so one answer, please. Let's see the results, Haley. Respiratory disease. And then followed by vector-borne. Mental health. Thank you. So we do have we're beginning to set some priorities towards the end of the course where we should take actions and where we do create a regional action plan. And that's clearly what Dr. Hospitalis is working on and is advocating, Earth Medic and Earth Nurse. So what can we do? What can we as health professionals and other professionals do together? And so what I haven't said yet, and I will do now, is in order to address the impact of climate change on health, we must do it in a transdisciplinary way. Not a physician, not a nurse, not a public health professional, not a tourism expert, not a mental health expert, not an environmental expert. We have to do this together. And so we need to retool patient education. I mean, how do we do that? We need to serve as content experts and trusted messengers. We need to have our public health agencies much more involved in preparedness and prevention. We need to expand medical education, and I'll come back to that, and that is one of the drivers of Earth Medic. We need to conduct regional surveillance studies. And knowing what the disease burden is without data, we can't take intervention actions. We need to serve as advocates for adaptation and mitigation actions. We shouldn't be only satisfied with adaptation. We need to highlight the things that happen to us, individual stories, and we need to identify those vulnerable groups who deserve our highest action direction. And so a little bit back to where I started when I was at the Centers for Disease Control and Prevention and was asked to create for the country, for the USA, a national public health workforce development strategy. And so I share this here because it cuts across all disciplines. The first thing, the 6 elements, the first element is who is there, who knows anything? So monitoring workforce composition. The second one is what do people know and what should people know? So creating competencies. Then how should people learn? We can't all, if this was an in-person conference, I don't think we would have this many of us here. So what's the integrated learning system that we need to put in place? What's the incentive? You talked about earlier on, Dr. Hospitalis, about CME. What's the incentive? What are other ways that we can incentivize our professionals to begin to learn about how to counter the impact of climate change on health? And then we need to do the so what piece. What is it that are we making a difference? And what's the research that goes in it? And what's the portfolio that we will end up at the end of this course? And we can't do anything without money. So these 6 elements are the foundation and the pillars for creating a broader workforce development roadmap. Quickly, I know I'm running out of time. This is a good reference guide that the Pan American Health Organization developed, and here's the link for that, a pocket guide. You'll hear a lot more from CIMH, and of course, they are co-sponsors of this course. This is an example of their climate and health bulletin that comes out. What I wanted to share with you is something that we've done funded by NOAA, working with Dominica and with Puerto Rico, is an environmental scan as a way to begin to understand what the impact is of climate on health. So it helps us to look contextually on the intersection of public health and weather. It's informed by local decision making, and it has broad stakeholder impact. So in short, it looks like this. We assess, there are 4 domains. We assess the public health infrastructure. How is information and data transmitted? What about that workforce? What's the capacity of the organizational setting? What are the essential capabilities in a country? from surveillance to laboratory to epidemiological investigations. Where are the health disparities? What's, for example, the access to healthcare? And then ultimately, what are the top diseases? One of the Zoom polls I asked you about, what are the top diseases that are climate sensitive? That information together will give us the health vulnerability to weather and climate. And that then begins to create a roadmap to action. So the 3 Ps, how do we promote resilience in the context of climate change? Prevention, don't let it happen in the first place, although we're far away from prevention already. Prediction, we can do that using data to model or anticipate what will happen. And preparedness, we definitely can do that using these predictive models to get us ready. Set of resources that will be available to you. Shamelessly advertising the 3rd edition of our book, our textbook in environmental policy and public health. It's an excellent tool for those of you who teach. It has practice questions, and it took 18 months of my life. So please use it. And this was the theme of one of the American Public Health Association conferences, Climate Does Change Health. It leads me to acknowledge and thank my collaborators. Thank you. We'll stop sharing now and look forward to the questions.
Thank you very much, Professor Lickfeld, Maureen. Thank you to all the participants who are on. We had almost close to 100 people who joined us from the beginning to the end. Apologies for folks having to switch rooms and some not realizing that towards the end. So the next half an hour or so, we're going to deal with questions and answers. And Haley has been collecting up the questions. I think the questions are in, first of all, 2 big categories. One, and I like to address the first one first, which is all the questions that came about certification and assessments and materials. And if I missed something, I would ask Cecilia or Lauren or Paula to chime in. First of all the materials will be available and will be mailed out to you immediately after each lecture. This is the first of 10 lectures every Wednesday evening for the next 10 weeks, plus the skills and practice sessions for which you have to register separately. You will receive a certificate from Columbia and Arithmetic upon completion of at least 70% of the lectures and passing a little test at the end, as normal for any course. CME certification is separate issue, and for that you must complete by the end of this, within 2 hours of the end of this course. Please make the request that you would like CME certification, and an email will be coming out to tell you how to pay for that. The course is free, but those who wish continuing medical education credits, there is a charge, which was explained in the beginning. So those are a lot of the questions that pertain to the course materials, the assessment, the certification. Cecilia, what have I left out?
I think you got most of it, James. Let me think. To do the Qualtrics survey, we want to collect some baseline data. And so it would be fantastic if everybody could fill out the survey so that we know where we're at and where we need to go. So thank you so much.
Thank you. So Cecilia, you were in the other room before when we started. So happy to welcome you almost face to face, and to give a shout out to Cecilia as the director of the Global Consortium on Climate and Health Education at Columbia University, with whom we've been working these few months to prepare this. I see a lot of complimentary comments coming in the chat, and we have just over 500 people attending at this point. So if you missed it at the beginning, I said welcome. I said bonsoir, buenas tardes, who the dog, And we're really happy to have everyone from mostly from the Caribbean with us, all the different professions, the doctors, the nurses, environmental health, hospital, academic, primary care. It's just great. So I hope we've answered the questions. Haley Campbell, is available to answer other questions on the sort of practicalities of the course. Boa noite. Okay, that sounds like Portuguese. I don't know. So let's switch to the next category of questions, which were those that came in the question and answer, and some were in chat. And they're of different kinds. You know, if you think climate is a health crisis, and if you're attending this course, you're probably among those who are persuaded, but not everybody is. So the first group of questions I'd like to address and have Maureen and myself have a stab at is, how certain are we about this really? She addressed it, but let's go back to that. Why are there so many climate deniers? And let's look at that and dig into it a little bit. So the first question, and the group of questions, is around how certain we are and how to deal with people who are in denial. There's a saying that there are doomsday people who say it's all going to end, never mind. And then there are deniers, and neither of those are very helpful. So let's address that. Perhaps, Maureen, you could speak again just to recap. How certain are we about this?
Actually, there's a remarkable comparison between environmental health and climate change. You can't often feel it, you can't see it in terms of chemicals, some chemicals. And so the best example I can give was a mayor for the US, you'll appreciate this, in a very conservative city in the south of the US, who was asked whether he believed there was climate change. He said, no, this climate change does not exist. And then the reporter kept on asking. He said, well, what are the key issues that you're dealing with in your city? And the mayor said, well, there is drought, and we don't have enough produce coming out of our fields. And so if indeed we need to use the symptoms to address climate change, and that's okay with me. And so if this mayor doesn't want to, is a denier, but yet identifies the symptoms and agrees to work with us to address those symptoms, then that's okay. And so you need to meet people where they are, rather than spending really positive energy to address somebody who will not be converted to believe it. I think it's the impact that will happen. And I have to say, I have not met many people, in fact, very few people in the Caribbean who do not, one, realize it and see the impact. And so whether you take tourism or agriculture, flooding, or having to migrate, it's all happening in the Caribbean. And so I haven't seen many, but the point is, because it's less visible, because it's not immediate like a pandemic, it is more difficult to convince, but our energy should not go into convincing. Our energy should go into what's happening around you. What is it that is your concern? And then work back from that.
Thanks, Maureen. I wanted to build on what you're saying. You know, somebody says to you, but climate change, this has happened before. So how do you react to that? And I think the answer, if I could suggest a sort of formula, is I used to wonder the same thing. Second thing is, yes, the world's climate has changed before. Third thing is, however, what we're currently experiencing is like nothing has happened like this for hundreds of thousands of years. Carbon dioxide at 420 parts per million in the atmosphere. And so it's clearly due to human activity that's doing this. Another aspect to why there's so much climate denial is our own brains. Brain science tells us that people have a hard time seeing something that's very evolving very slowly. We see dangers right in front of us much more quickly than something's evolving slowly. We don't like things that are uncomfortable to deal with. So some of the brain science reasons, psychology reasons, tells us why there's a tendency to denial. And finally, and importantly, like with the tobacco industry, the fossil fuel industry, there's been a lot of financing of misinformation and disinformation around climate change. So that fuels some people who are not well informed and they deny. So those first couple of questions dealt with, is this real? And how do you respond to somebody who is a climate denier? And I think you say to them, yes, I wondered the same thing. Climate did indeed change in the past, but what we're experiencing now is because of human activity, and the scientific confidence in that is extremely high. And if you open your eyes and talk to people, well, what are you experiencing? The fires, the heat, the erosion of the coastlines, the storms that we never saw before, then you have the proof of the pudding right there. But don't discount the industries that don't want this to be focused on. A lot of questions are around. Let me find my my list of questions here. There are specific questions on. Let's deal with them very specifically and quickly. And how do you begin to interpret Sahara dust as a climate change element? It's been in the weather all these years. I'll quickly say yes, that is true. Sahara dust has been with us for centuries, but not at the levels that we're seeing. In West Africa, about 100,000 tons of topsoil are blowing off every year. As they become hotter, drier, there's more destruction of forest for logging and for agriculture, and the topsoil is blowing off. So it's connected, these issues of how the environment is being destroyed, leading to increased Sahara dust that is coming over to our side of the world and leading to some of the respiratory problems that we have. There's a whole bunch of questions about what can we do. We'll come to that in a minute. Let's deal with some of the science and the links before, including what can we do in the health sector that Dr. Prasad has asked, which is a really good question. Climate change and food security. You want to have a go at that one? Maureen, how does climate change impact food security?
I'm so glad you brought it up. If within the impacts or among the impacts of climate change, food security and food safety are the singular highest ones that actually will help us convince those that are still denying that it's real. And so food security is how much food we have or how much food we don't have to avoid malnutrition, not only in pregnant women, but particularly in young kids. Food safety is, and those are, it's a cyclical relationship. If there is less productivity from an agricultural perspective, farmers tend to use more pesticides, and more pesticides impact the safety of the food that we have. And so food safety and food insecurity are inextricably linked. And whether it's through drought, or through flooding, there's a direct relationship with climate change.
Thank you. Thank you. You know, in Trinidad and Tobago earlier this year, there was a lot of headlines about how the cost of foods are going up. The cost of coffee, the cost of orange juice, the cost of soybean oil. What people are not pointing out is Brazil, which is one of the major producers of these things in the world, is being hammered by climate change and drought. And so the production of all these things is declining. So your global supply chains are affected. And so your food security is also affected. In Jamaica and right across Central America in 2015, there was a big drought. And that led to a lot of agricultural and food supply issues. Next question, Maureen, a specific linkage between climate change and invasive species.
So I mentioned very briefly One Health, because in some instances we have deforestation and erosion of our land, And this is human behavior again on both sides. And we're invading the species that are just happily living where they are in the forest. We are invading their territory. Both of those actually result in a double whammy. And there are more and more invasive species closer to us. I mean, that's however you want to look at SARS-CoV, that's, and any of those species that where human beings have not been in contact with. So that's so human behavior, taking away where the species live, biodiversity loss, in addition to land use, are all reasons why we have invasive species. And it will happen more and more. And species that were almost only living in animals are now beginning to infect humans, and will soon become more like parasites living in us.
Thanks for that, Maureen. I think if you look at the United States, you can see CDC and others have published papers that the distribution of ticks, which cause certain diseases, are spreading from the hot south and they're going further and further north. So you have diseases that never used to occur in the northern US areas, and suddenly they are. I have a friend who's in Alaska, and he's telling me that the caribou herds are dying because the temperatures are so high in the winter that the ticks are overwintering. And therefore, they then cause massive tick fever in the caribou herds, and that's what people have for food and for other sources of nutrition. So food security is affected there as well. Impacts of climate change on maternal and child health.
Oh, in so many ways. It begins almost pre-pregnancy, definitely during pregnancy because of food security, food insecurity, and food safety. Anemia is one of the greatest causes of that in young kids. Then we also have adverse birth outcomes, prematurity. All of those are impacted with life during pregnancy for the unborn child, and then the 0 to 5 year old area in the 0 to 5 year age bracket. And so children are vulnerable even before they are born, and definitely in the first 5 years. One of the things that I didn't talk much about here is the exacerbation of exposure to environmental stressors, so environmental contaminants, and whether those are metals such as lead and mercury, or volatile organics such as pesticides. Those also impact the development of the brain, so neurodevelopment of the children. And so even beyond the physical impact is also the developmental impact. If moms are stressed, kids definitely are stressed as well, and you see that in the neurodevelopment. And so children and pregnant women are almost number 1 and 2 communities and people of concern, actually, from climate change.
Thanks, Maureen. Somebody asked a question about the COVID pandemic and its impact on climate. I popped into the chat a piece I wrote last year in the British Medical Journal on the link between COVID and climate. And just to talk about this a little bit more, COVID is about the 10th pandemic of the last 100 years that we faced. There's been about 10 pandemics in the last 100 years, and they've been increasing in frequency. And when you look at the drivers for pandemics, we're set to get more. Why do I say that? The number 1 driver is human-animal contact, which has to do with destruction of the environment and humans encroaching on animal territory. And they then come into our houses and so on. So COVID jumped from a forest species to a human. The second big driver is international travel. Before COVID, we had over 1 billion international travel arrivals per year. That's a lot of people moving around. So you have the scope for rapidly moving a disease from one part of the world to another. The third big factor is the health of the herd. If you could liken the human population in that way. We have a lot of chronic health problems, obesity, hypertension, diabetes. We have an unfit population. Whatever comes along, you're more likely to see serious effects. And the third is climate itself. The increased heat is good modeling that shows it's accelerating the multiplication of vectors like Aedes aegypti, and you're getting more frequent and more severe outbreaks of dengue, Zika, chikungunya in the last years. So I wanted to dwell on that for a little while. There's quite a connection between the destruction of the environment that's helping to drive climate change and animal-human contact that is partly behind the COVID story.
Yeah, we also know that people with existing respiratory disease, but also people with diabetes, people with hypertension and cardiovascular disease have been worse off. We have not talked about the role of communication and the miscommunication, whether it's deliberate or not so deliberate in the context of COVID and preventive actions. And we are facing some of the same in the context of climate. I am part of a Nestle Academy of Medicine climate communication initiative solely focused on strategies around communicating about the impact of climate on health.
Thanks for that, Maureen. So we're going to try and answer everything that people have asked, not necessarily right now, but get back to you with answers. But I want to change gear from some of the impacts and the linkages to what can we do. And before we lose it, I want to get the question that Dr. Prasad has asked here about the healthcare system itself. And when you look at the literature, the healthcare system is an industry that's responsible for almost 5% of global emissions. So we who work in healthcare are part of an industry that's emitting more greenhouse gases than Japan or Brazil. Makes you think, doesn't it? So what can we do to put our own house in order? And within that, if you look at it, you see energy is a big one, but also what we prescribe as doctors, how we diagnose things, how we treat things, what food we serve in the transportation, all these are there. So what can the health sector do to help address this? I think, Maureen, is the next thing we should face.
So the health sector, there are almost three layers. The first layer is what's the physical infrastructure that we're planning to build. So the health sector, where is the hospital located, or where is the clinic located vis-a-vis where the patients could be? If everyone has to drive to a healthcare system, and that increases the transportation. One. Second is what's our organizational setting, and what do we do? What is the content of what the health activities are? How often does somebody need to go to facility A for kidney check, and facility B for eye check, and facility C for diabetes check? How do we construct an integrated health system, not healthcare system, that has both the preventive services as well as the treatment and secondary and tertiary care services? The third element is until we require, and I'm going to say it and I'm going to get flagged for this, until we require that every health professional is competent in how climate impacts health, and that includes being on board, that includes the accreditation of hospitals. Until we require that, we're not going to have the kind of workforce that will demand change. And that is on us as health leaders.
Thanks for that, Maureen. And I think this serves as a moment to point out April 19th, we have a skills and practice session on greening your practice. So this is practical stuff that you could do to improve clinically and improve the health facility that you're in. I know in Trinidad, energy is really cheap, 5 cents a kilowatt hour, but almost everywhere else, it's 25, 30, 35 cents a kilowatt hour. Brian James in Jamaica, the president of the Medical Association, was telling me it's 30 cents a kilowatt hour. Well, that's a heck of a price to be paying for electricity, and there's a lot that could be done to reduce that. And it's an opportunity to mention that on June the 1st, we'll be having hearing from Pan American Health on healthcare sector mitigation and from Healthcare Without Harm of the US on how do we reduce have safer facilities, have greener facilities, and a personal interest of mine is how do we have more health promoting facilities for staff that work in the health sector. So that touches on what we need to do to put our own house in order among the questions. And then the health sector, I think, has a responsibility. Once we awaken that, wait a minute, this is the biggest public health threat that we face, then we have responsibilities for talking about it to our patients, to the community, for advocating with policymakers. And that then brings maybe to the next group of questions, which have to do between the links between politics and climate. And it's a good question here about links between democracy, socialism, and climate change. And how do we hold countries responsible? Some countries are pursuing a growth. Most countries in the world are chasing growth, economic growth. But how do you get economic growth and not adversely affect the climate?
Working backwards from where money talks. So if tourism is down, and if we have to pay more for our food products, and if our transportation directly increases the cost and more people with respiratory disease, then I think we will get change. But again, not using the way and taking the IPCC report and saying, see, we have scientific consensus, you need to do something about it. It's where the money talks.
Thanks. Related to this are access to finance. I think Jonathan Bratt's asking this question, how can we encourage smaller developing countries to be more climate friendly when they lack the financial resources and infrastructure to transition? That's a really great question. It's a central issue for the Association of Small Island States. And some of you may know that the Prime Minister of Antigua and Barbuda and the President of Tuvalu have formed a commission of small island states and international law advocating for access to finance based on vulnerability, not only on per capita income. So that's an important argument. Now, in order to make that argument, I think we in the health sector have a responsibility to strengthen the data and the research that shows how much we're suffering. Data on the excess mortality, data on the environmental damage, data on the human damage. I'm going to focus on some of the vulnerable populations. You know, in Puerto Rico, after Hurricane Maria, the official death count was 64. But a lot of good work showed that in the months afterwards, the real excess mortality over what they would normally experience was perhaps as much as 3,000, 2,000. Compare that to 64. So it's important that we have better information and data collection systems, better research that is able to show that impact, that helps to make the case for financing based on vulnerability. What shall we tackle next? Well, we can go back to some of the specifics on heat and on heat and health impacts in the Caribbean, which is something we were discussing quite recently, because there's a welcome trust call for research and interventions on heat. Maureen, you want to comment on that?
Yeah, as I mentioned before, heat directly impacts all of us in the Caribbean, and particularly because of how our homes are built, what we can afford in terms of this. Not everybody has an air conditioning or an air conditioner in their whole house. The increased temperature outside, the lack of the increase in hurricanes and other storms and weather events that directly impact weather and heat. The vulnerable populations that are virtually all, whether it's pregnant women or young kids or agricultural workers, and heat does impact virtually every organ system: cardiovascular, respiratory, um, kidney, as you have seen. And so one of the things I forgot to mention when I was talking about training the health workforce is, just like we train health professionals to take an anamnesis, to take a history, and we've done that to take an environmental health history, it is more than time for health professionals to learn how to take a climate and health history. And so heat will come out as being the major culprit of some of exacerbation of existing diseases and creating new diseases, such as chronic kidney disease of unknown origin, related to heat. And so I think we cannot just say, oh, these are the hot months and we should live through them and it will become cooler. The hotter months are hotter, and the hot times, the heat in our countries are for a longer period of time. And that's why I started the lecture around variability versus climate change.
Thanks, Maureen. We have questions from the Bahamas and what should be done. Our next session, next week, April 13th, will focus on hurricanes and extreme weather. We have questions just concerning the question on heat. On April 27th, we have heat and temperature-related illnesses, which is going to be delivered by Pablo Mendez from the University of Puerto Rico. So just to give you an advertisement for some of those that are coming up. Gosh, there's so many questions, but we should touch on this one. Indigenous populations and climate change.
Yes.
How can, Maureen?
Well, in the US, in one part of our country, there in Louisiana, we have the first, and they don't want to be called that, but we have the first climate refugees. Their land is underwater and they had to move. In Suriname and in many other countries where indigenous populations live, they are directly impacted because they live from the land, they live from the rivers, they live from fishing. And so in many of those tribal nations, they had to move away their agricultural areas away from the riverbanks because of the consistent flooding, not only of where they plant, but also where they live. So they had to move more upland, where the land, the soil is less fertile. And that introduces the use of pesticide that was never the case. Moving away from where they used to impact their culture. So there's not only a physical impact, there's also a cultural and a mental health impact. And we don't spend enough time and give enough visibility and attention to indigenous populations. So I'm very pleased with us asking the question, you asking the question, and us having the opportunity to discuss that.
I think indigenous populations also have a lot of knowledge that can contribute to the solution. Indigenous crops are often better adapted to our, and we see what's happening with the Ukraine and Russia and wheat. So we've really got to be looking back at what our ancestors did, indigenous people. We've lost a lot of knowledge. So it's important to preserve that.
I would be remiss actually not to mention that the loss of, because we have loss of biodiversity and we have land loss, we also lose medicinal plants. And so the availability of medicinal plants become also less.
One of the big consequences of climate change is sea level rise. There's a question in here about that. Are there tools to determine where in your country has the highest places in the level of sea level rise? The answer is yes. And we'll be dealing with some of the early warning tools later on in the course. But definitely for the Caribbean Islands, Trinidad and Tobago, we have Lower Jamaica, Bahamas, Turks and Caicos. A lot of places have Guyana, Suriname. When you look at the projections for what's going to happen, there are some places, if you're a young professional, you should not take a mortgage because it's likely to be flooded out very often by 2040, 2050. Question on how to get youth more involved, and I think we'll make that the last one. Maureen?
We can't start early enough. And in fact, we know from environmental health from public health in general and environmental health specifically, that children, educating children, and who then in turn engage their parents, gives greater success than talking to adults. I think we know that from psychology that after we are, beyond 35 years of age, it's tough to change people's behavior. That's why we are talking about climate change. But so starting very early with gardens, school gardens, and talk about what climate is and how it impacts. So starting early, have the kids bring it to the parents or the school teachers, work with science teachers in middle schools as well as in high schools is the way to go.
Thanks, Maureen. Paula, Henry, you've got your hand up. You wish to say something, or Dr. Henry?
Hi, I'm Dr. H. Can you hear me? Don't forget to tell them that those who need CMEs need to fill out the link in the chat.
Thank you for that reminder. Those of you who need CME credits, you must fill out the link in the chat within 2 hours of the end of the session. To add to what Maureen was saying about youth, we have 500 people with us. About youth, I think in the second, we had a special session on youth and climate in October last year, focusing on the schools and the schools of health sciences, where there needs to be a bit of a revolution to include more climate in the curriculum. And the secondary schools and how to persuade the Caribbean Examinations Council, for example, to pay more attention to that. So those are 2 other tracks in the educational system where the advocacy is needed. So yes, the link for the chat is the link for the CME is you must the link for if you wish to claim CME credits. Thank you, Haley. Please fill in the following evaluation for the CME credit. It only remains active for 2 hours after this. Somebody saying it's not working. Haley, can you, it seems to be working when I clicked on it.
The link seems to be working on my end, but please email me with any questions about CME or the course. I'll put my email in the chat, and I think we're good to wrap up, Dr. H.
Thank you very much. So thanks everyone, 500 and some people who stayed with us for this first lecture. I hope you found it stimulating, thought-provoking, and that you'll be rejoining us next week when we'll be focused on the signature problem we have in the Caribbean of hurricanes. We'll be hearing from Dr. William Hamilton in the Bahamas, who weathered Dorian in Abaco Island, an absolutely amazing storm that represents how storms have changed in their behavior. Thank you, Professor Lechfeld, Maureen, for the lecture and for answering the questions. We will try to get back to any questions that we have not answered to this point. Thanks to the team behind the scenes on this, Cecilia, Paula, Lauren, Haley, and good evening, everyone.
Yes, and thank you for making this possible and for the opportunity for me to contribute for what will be, I'm sure, an outstanding course. Thank you.
Thank you very much.